Good morning, everybody. This is Tammy Castrini from Insurance Advisors Direct, and thank you for joining. We have Scott Miller here today from RetireFlow. We're really excited to hear about their product and send it out to the agents. A little housekeeping. Everybody, the chat is disabled, and you can put questions and answers into the Q&A. I will monitor it through Scott's presentation, and we can stop at the end and also have questions and answers. And this will be recorded and will be up on our YouTube channel probably in the next few days. So with no further ado, Scott.
Thank you. Thank you. Thank you very much, Tammy. And good to be with everyone from IAD this morning. As Tammy mentioned, my name is Scott Miller. I am with RetireFlow. I'm actually in the business via owning a insurance agency, a small LOA shop out of Columbus, Ohio. Created RetireFlow out of a need of our company. So we originally built RetireFlow to solve a problem that we had as our business grew. And the good news is with our businesses, we can grow our business. The result of that growth can sometimes lead to obviously more service issues, but also during AEP, you get a lot of your customers calling you and saying, hey, am I good for next year? Or they use the famous Joe Namath line, hey, am I getting the benefits that I deserve? So I actually had my father-in-law call me. I tell this story and said, Scott, am I getting the benefits I deserve? And I about threw my phone across the room because I knew he got that straight from our good friend Joe. What we determined was when we were sitting down or meeting with a prospect or a current customer, we're doing a review, you need 5 things. Basically, it boils down to 5 things: prescriptions, doctors, hospitals, pharmacies, and some lifestyle preferences. Things like if you plan to travel, budget, and those types of items. Those first 4, though, are very hard to get and do it so efficiently and compliantly. So what do we need to do this? We needed to create a workflow that made this an efficient process. Couple that with increased industry noise and competition, growing compliance demands. Like we all know, we've got the phone recordings now. We have 48-hour scope coming up, and then these folks show up to our party. Right around COVID, our good friend Mike Ditka, Joe Namath, William Shatner, Medicare Martha, who might be my least favorite of the group, show up on our doorstep and kind of stir up our customers, ask questions like, is my plan okay for next year? Am I getting the benefits I deserve? Where's the cash back dollars on my Part B? So with all of that being said, we embarked on creating a survey that you can send your prospect or clients prior to a meeting. And say 13-question survey. And if you can see the phone on the right, the font on this survey is humongous. It's easy to read and use. It actually looks really good on folks' smartphones when they use their smartphones. But our survey gets you 3 things. It gets you a list of drugs, doctors, hospitals, and pharmacies. It gives you permission to contact once they complete it, and it provides a 48-hour scope of appointment. Once your customer completes these 13 questions, a PDF is instantly generated and sent to your RetireFlow dashboard. You're notified with an email that you have a submission on RetireFlow. And basically how it works is your link will live on a website. So retireflow.com, for example, I'll use Tammy as an example. retireflow.com/Tammy could be your link name. You get to name that link. You can see by this on the screen, you can see your picture will be on there and it'll follow your customer through the survey. We use Connecture API tools, which is a fancy way of saying when your customer types in Lipitor or Lipitor pops up. And when Lipitor pops up, it says, do you mean you take the generic equivalent of atorvastatin? Our survey this is really important, is HPMS approved, which means it's CMS approved, and HIPAA compliant. It is secure at rest and at transit. your client's information is secure. It is incredibly sticky. And what we mean by that is when you send this link out and they complete your survey, it's very unlikely they're going to take the call from Joe Namath or work with an agent down the street or work with a captive agent. It's very personal. Your picture follows them on it. Easy, big font. It's a sticky survey. When we created this, we didn't anticipate this next point of being a liability protection service. So I'll give you a personal experience. In our agency, we received a grievance from a beneficiary from Anthem. That's the beneficiary claimed, hey, I went to the pharmacy. I told my agent that I was on a prescription medication. And when I got to the pharmacy, my pain medication wasn't covered. We were able to review the PDF with a timestamp CMS approved PDF document showing that beneficiary did not list that particular drug on the on their survey. So within 24 hours, Anthem determined that claim was unfounded and it was sent back and we were all clear. Here's what's probably the most important moment of this discussion this morning. We believe this is a retention machine for a couple reasons, but the one of the largest benefits of this survey is there is no username and password for your customer to complete. So there's no barrier to entry. When they send a link, your link will pop up with your picture and they go right into answering the questions. So there's no deterrence for them to fill out a username and password. If you're like me, if I'm looking for real estate or a car or something like that, and a username and password pops up, I instantly abandon. With RetireFlow, there is no username and password. Our first day of operation was September 15th. We spent most of 23 building this. CMS process took longer than we had hoped. So our first day of operation was September 15th, which was a Friday. Our first customer was an agency out of Northeast Ohio. Had a nice business, 2,000 customer business. He bought a link, and then on Friday evening, before he went home, he sent an email out to all his clients with that link in it, and it said something like, if you're looking for a review this AEP, complete the following survey. Over that weekend, he went on a walk with his wife. He watched Ohio State beat Notre Dame. That was the same weekend. And then on Monday morning, he went into the office at 9 a.m. and had 200 submissions on his RetireFlow account. He sent the same email out 4 more times and ended up with 936 submissions before October 1st. So he was ready to go with all these PDFs and the information prior to October 1st. And he had worked it into his workflow pretty successfully. And Tammy, any questions that you see before I start this demo?
Yes, we do have one question from Dan. He says, can you say if the agent owns the client rights of information, or does RetireFlow own the information?
Yeah, that's a great question. We cannot see any of the information that your customer submits or the PDFs. We are walled off from that. CMS made sure of that. But that information is, well, you'll have a username and password on RetireFlow, and that information will be in there in perpetuity. And once you get it on there, you can download it to your CRM. However, to answer your main question, we cannot see any of your submissions. There's a firewall between that. We have no access to that, nor do we want it. We're not FMOs. We're creating a software as a service here. So is my screen still up there with my picture?
Yes, it is.
Right. So this is what a sample site would look like. A sample link would look like. Your picture would be in the upper or the left corner. Your logo would appear in the top left corner. and your agents or the state licenses where your licenses are there, hometown, and you go ahead and get started with this. And I'm going to show you what one of these looks like. Hey there, I'm Scott Miller, and Tammy, we're gonna act like you're Susie Senior, our customer here. So I'm going to
Okay.
ask you a couple of questions along the way. Let's say Susie Senior uses an AOL email. Now, here's something to note. All of our questions are optional. So if Susie does not have a email but has a phone, she could you can go through this question without answering it, and you as the agent can still get drugs, doctors, hospitals, and pharmacies. Okay, Susie or Tammy, how familiar are you with Medicare?
A little familiar, but I don't know where to start.
Okay. All right, we're going to put in your name here, Susie Senior. It's important because this is intuitive. You'll see it says, "Hey, Susie, let's get started." Tell me about your current health care, Susie. What do you have currently?
I am already on Medicare.
You're already on Medicare. Okay. You know what kind of plan you're on. If you don't know, that's okay. We all recognize that many customers think they're on a supplement, even if they're on Advantage. What are you on, Tammy? Or Susie?
Medicare Advantage plan.
Medicare Advantage. Okay. What's an address near you, Susie, that I could type in here?
That is a good question.
your
What is put in 476 US 31? Put in a south, like an S for south there. And it's Traverse City, Traverse. There we go, Michigan.
That in there. Well, let's see. I messed that one up. Give me another one that's that I didn't mess up here. 31 South US 31.
476 US 31. So yeah. US 31 south, so just S. And then Traverse City.
There we go. There we
There
go.
we go.
Okay. Thank you. And what you'll see is it'll auto-populate the county and the zip along with that. And why that's cool is because when we start to look for pharmacies, it'll pull that zip code over and so you can search for pharmacies in your area. What's a pharmacy near you?
Put in CVS.
Airport Road or Front Street? Which do you prefer?
Front Street.
Front Street. Okay, you can add up to 3 pharmacies on this question. If someone, winters in Florida or Arizona, they can put those, and sometimes people have multiple pharmacies locally as well. Okay, now let's take a look at our prescriptions, and we ask our customers before they answer this question to go get their prescription bottles. But let's say Susie takes Lipitor, like I mentioned. LIP pops up, and then it says, "Do you mean you take a atorvastatin?" Yes, I do. And then common dosages and frequencies will appear. 30 pills every month. Let's add another one. Let's add Ozempic. It's a popular drug these days. And what's neat about when you populate Ozempic, it'll recognize that these are dispensed in non-traditional means as an injectable. So those non-traditional means will pop up so your customer has no problem navigating. All of our information is correct. Now tell us about your doctors and hospitals. What is a hospital near you, Susie?
Munson, MUNSON, medical center.
Okay, Munson Medical Center. Okay. You can add any more hospitals. All the hospitals that are that accept Medicare are in this. On physician, we ask first and last name of the physician. So let's say she goes to Gregory House from the TV show as her primary care physician. And then she goes to Meredith Gray as her cardiologist. And you can list endless specialists. That's fine because a lot of times people have 5 or 6. Okay, then we ask, what are your preferences on a Medicare plan? Do you mind paying copays for medical services? This is the MA versus SUP question, basically. So I'm assuming Susie doesn't mind paying copays. Is that correct? Okay.
Correct.
And this is a good question to ask, especially for your new customers. Do any of these apply to you? Wouldn't it be nice before you go meet with somebody to know that they're on the federal retirement plan or a postal employee retiree? We meet with people sometimes, and 30 minutes into the meeting, they will tell us they're on the federal plan or something. So let's say none apply to Susie. Okay, Susie, we're almost done. We're going to ask Susie's phone number and hit OK. We're going to ask Susie's age. How young are you, Susie?
67.
67. Now, originally this was date of birth, folks, but CMS made us change it to age. So that was disappointing in that process, but we have to remain compliant. So let's get this wrapped up. The last screen that will appear will be the scope of appointment. This is a precursor to that says it's not a big, scary document, gives them information about what they're about to look at. And then the scope of appointment appears with a big blue glowing boxes that Susie puts her initials in. Susie puts her initials in. And then she signs it using one of these signatures. Susie sounds like she's fancy, so we'll use this fancy one and sign and complete. And then the screen that comes up is awesome. You're all set. Scott or Tammy from IAD will contact you soon. And then as this happened, my phone just buzzed and I've got an email that says you have a new submission on RetireFlow. And let me show you what that looks like when you go to your dashboard. So you would go on to retireflow.com, sign into your account, profile, and then you see this blue submission center. Click on that. Click on download the Susie Senior from 11:48 a.m. Eastern time shows up. We open up the PDF and all the information we just entered appears on your PDF. This document is yours you can download it, house it on RetireFlow on your dashboard, however you want. You'll notice under Ozempic, we have a new relationship with ADS, Diabetic Supplies folks. It recognizes if anything is diabetic medication, and you can utilize their services to get your folks free delivery, inexpensive prices, and the best prices. I shouldn't say best. The prices on their diabetic medications. And then if you go through there, it's got all the information, Munson Medical Center, Meredith Gray, cardiologist. And the last document is the signed, CMS approved, compliant scope of appointment with her signature, time stamped. We leave the agent signature part blank. If you need to produce the scope, simply print it out and sign it. And heaven forbid, if you met with somebody 47 hours and 50 minutes prior to the meeting, you have a little bit of flexibility. Questions? Any other questions that arise?
Let's see, I do see one from Dan. Do you stress the 48-hour rule during the gathering of the SOA form? Do you save it for 10 years or do we need to download and save?
It'll be housed on RetireFlow for all the time. We download it to our CRM.
Right. So I think if they have a CRM, they can download it through there, or if they have a secure network drive, they can save it kind of however you're currently doing it, you can do that. We should always stress the importance of saving that information for the 10 years. We don't know when that's going to happen, but as far as
you never know.
As far as it being stored in RetireFlow, it's in perpetuity, right? So
the pricing of the links is as follows, and there's a but coming. So our link cost is $49.99 per link. Doesn't matter how many submissions you have. It's unlimited submissions. So the gentleman that I mentioned earlier that had 936 submissions, he paid the regular link cost. The big but that's coming here is because IAD is Insurance Advisors Direct is providing us the opportunity to speak with you. They've negotiated a price of $29.99 per link. And that is per link. If you have a small office of 2 people, sometimes people will share that link. If you have more producers than that, it would be cost per link within your organization. Okay, there's something else here now. To get started and create your own link, you would just go to retireflow.com and click this big blue Get Started button. And that will ask you 5 or 6 questions. That's where you will put in that promo code of IAD40, which means 40% off, IAD40, and it will lower that price from $49.99 to $29.99. After that, you go to create your page, and I'll show you what that looks like. Since I've already created my page, it'll look like this edit button. It'll say create a page, and you'll go in and put your headshot in there, your logo, your agency name, your account name that you want to go by. That'll say, Scott Miller from Seniority or Tammy Castrini from her agency. State licenses, you want to list there, your hometown. You can list your Facebook and your social media posts here if you would like. If you don't want to do that, you don't have to do that. And this is where you create what your link is, like Seniority. Like, let's see if Tammy is still available. Tammy is not available, but I'm sure Tammy with your last name would be available. But that's where you create what your link is called. Okay, and then down here at the bottom, you send email notifications to where I receive my submissions. I put my email in that box there. And then at the bottom, you hit Save Changes, and your survey is live. So it really takes folks about 5 minutes. The biggest hurdle we seem to find is people need to get their headshot on their phone or their computer to be able to upload it right there. Questions?
One question is, can you cancel at any time since AP is the busiest time of year and not need after that?
You certainly can. There's no long-term contract with RetireFlow, so you can have it for a month, have it for 12 months. You can do whatever. There's no contract on it. It's month to month. Now I will say this: the uses of it obviously are great for retention and the story I mentioned, and people all over the country are using it for retention. A lot of folks are also using this for new sales. And I would encourage you to join Medicare Island. It's a Facebook group for users of RetireFlow. There's a lot of people are sharing ideas on how they're using it for new business and retention. The part of our process in our agency with our producers is anytime they're meeting with somebody new, they send out a RetireFlow link to get all this information, helps with, one visit closes, it gets all their drugs, doctors, hospitals, gives you permission to contact, and gets you the scope of appointment. So it works in our workflow like, hey, someone called in, we're going to send you this link, need you to answer those questions. We have the 48-hour scope. We're ready to rock and roll when we meet with them. People have made this into a QR code to flash up at the end of a educational event. People are using this to work pharmacies. They'll create a QR code, so if a line develops when you're talking to them, they can click on the QR code. Here's an interesting fact: 65% of all submissions have come in on a smartphone, which really kind of shocked me. I thought it would be maybe 30%, 35%. But what we're finding is that folks, when they get to retirement, they're relying on these phones a lot more than their home computer. Maybe they put their computer away once they're retired. So kind of an interesting note there on that. So I would point out, and Tammy, RetireFlow is also creating in the next, it'll be released within the next month, an ACA survey, which will be a new link added to our products. So look for that. There'll be announcements in Medicare Island about that. And there'll be some further announcements about an ACA form as well, which will include the consent form.
That's fantastic because ACA is getting, there's a lot of compliance going on right now with those consent forms and making sure we have them and they meet it. And so the fact that RetireFlow is CMS approved is a great benefit. I agree with that. And I do have a question about how are you handling recordings and is that coming?
We
you want to
are
address that?
not in the recording business. It's a great question, but we are not in that business.
Wonderful. That's what I was thinking. So if it flows through, if you can get it to flow through into a CRM, then on the CRM, you would be able to do the call recordings. That would be one great way, I think, to handle that. And I would like to say with everything going on with 2025 and the Part D changes, the system like this is going to be incredibly handy for all agents, but particularly those with a large book of business to help make that flow through, get those appointments ready to roll. Everyone should very likely be looked at this year. So this is an invaluable tool to help with that. And I also noticed when you were creating your link, you have the ability to put up to 2 emails. So if there's an agent who has supporting staff who, helps with this process, they can get an email sent in as well. So they would see them coming through and that takes a little off the agent's plate. So that's also a nice feature that I saw.
Yeah, definitely. With the Inflation Reduction Act coming, we believe shopping will be up 100% or more. Just we believe it'll be our busiest year from a review perspective and also from a new opportunity perspective. So we are suggesting, and I know we will begin the process of reaching out to our clients on the 15th of July and starting this process early. And prior to having RetireFlow, we were sending out paper forms or forms that were probably not, well, they weren't CMS approved and likely not HIPAA compliant prior to RetireFlow. And we had to hire part-time staff just to transcribe all the drugs into a database. Now with this, your customers are inputting this. You get time-stamped verification of what their drugs are. You get permission to contact, you get scope, and it's all done in a very organized and clean fashion. And the seniors do complete it. The process works. It's very user experience is easy for them to navigate.
Wonderful. And I did have another question. It was about, Andrea said, this is amazing. What if a client doesn't have an email? If you wouldn't mind touching back on that again.
Yeah, a great question. And we've encountered that as well. If they have a phone and they are able to do it on their phone, even if they don't have an email, you're able to capture drugs, doctors, hospitals. A lot of people are texting their link to folks. And again, with the iPads and the tablets and the phones, people are able to complete this survey. The survey looks really good on a phone. Now, the second part of that is if somebody doesn't have a smartphone and an email, you are able to sit side saddle with them and complete it together.
Or they could potentially have a friend or family member help them with that as well.
That is correct.
Wonderful. I did put in the website in chat. I'm not sure if everybody can see it. Hopefully you can. But if you wouldn't mind, Scott, putting up your contact screen one more time. That way, if you're not seeing it in chat, you can take a screenshot or write down the information. The website is retireflow.com. And once you go there, you can start setting up your account.
Correct. Let me Go back here to, let me share my screen again. Yeah, if you go to retireflow.com, you all receive a follow-up email from this webinar, and it'll be a reminder of the promo code. Make sure you put that promo code in as IAD40. After you hit this blue Get Started button, it will ask for that information. It'll appear, it'll ask for credit card information, and then when you put in the IAD40, it'll drop it to $29.99. And there'll be, on your email that we send to you, there'll be contact information for you to be able to access us.
Fantastic. Wonderful. So before we let everyone go, does anyone have any final questions?
Thank you, everybody, for attending. It's been a real lifesaver for us. The first year we did this in 2022, we beta tested it. We had our best sales year ever and our best retention year ever, because it became an organized workflow that just saved us hours and hours. We shouldn't spend our life trying to listen to our customers spell levothyroxine, because that's a pretty tall task.
Absolutely. All right. Well, I do not see any other questions for today. Again, this recording will be out on our YouTube page in the next few days. We will send a follow-up email with everything that Scott has talked about. And we hope everybody enjoyed the presentation, and we look forward to working with RetireFlow and Scott in the future. And we will let you know when the ACA portion comes out as well, and we will have a follow-up presentation later this month. Thank you, Dan. Again, thanks everybody for joining today. Please reach out to me or to Scott if you have any other questions. But take care, everyone. Have a wonderful day.
Thank you, Tammy. Thank you.
Thank you, Scott. Appreciate it.
Have a great day.
Bye-bye, everyone.